When I get this title, I was wondering what I wanted to tell as a senior nurse to young nurses, if what you can do to develop experience. And I search on the internet and I read a lot of information, and there are two main issues that you have to develop experience, and that's first knowledge, because if you don't have any knowledge, you can't know what you are looking for. And then the second one is the experience self, and that's something you will only get when you are working in a ward and you see or you observe or you hear from other nurses what's going on with the patients and when they suspect it will be acute graft-versus-host or not, because the definition or the diagnosis themselves is mainly based on clinical issues and sometimes also because you don't find anything else and then you suspect it's acute graft-versus-host disease. Know your patient's story, because if you know his history, his illness, his donor, his conditioning regimen, you will have some idea if graft-versus-host disease is likely to occur or not, but it's not only the one who has a high potential to develop that can develop acute graft-versus-host disease, but also the one who has less signs, less possibility to get the graft-versus-host. So you have to see it for everyone, but we all know that the HLE, this match, if there's a male or female donor, what's the condition, are there infection and organ damage before, that's also taking in part of developing graft-versus-host disease. So know your patient's story and you will more aware about graft-versus-host disease when it occurs.